One of the things that amazes me, and I say this all the time, and I apologize for being so repetitive. The people in this space are really trying to do so many things. Very much, I always admire how you think about treating your patients, that you have to look at multi-systems of the body, you have to look at a much more cohesive approach. And our guest today, Jodi Neuhauser, who started a PAC, who started a platform called In Women's Health around education, who has run companies, really almost you feel like you're talking to an octopus. She has her hands in so many different places, and I think that's a good visual for what you need to do to make real change in this space.
100%. And as usual, much of her progress and her companies and her consulting and whatnot stem from a personal experience where she needed to improve that experience and make it better for other women. So, really the passion shows through. It is extremely exciting to hear about a lot of the innovations in the fertility space that we speak about, to hear about now how she's bringing this to a network of women to help really infuse talent into the medical and business world as it relates to women's health. So I'm excited to speak to Jodi.
Yeah, it takes a village. It was a statement that was made many, many years ago, but I think it speaks to anything where you're trying to make great change. So let's take a listen.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have our guest today, Jodi Neuhauser, who wears so many hats like so many of our guests. She's a multiple-time CEO, a serial entrepreneur. She is the CEO and founder of In Women's Health, as well as the Women's Health PAC, which she stood up very quickly before last year's election, and just is someone who has her hands in every part of the women's health ecosystem in the best way. So welcome.
Thanks, Rachel, and thanks, Alyssa. Really excited to be here. And the business of women's health is near and dear to my heart. So really excited to join the conversation.
So talk a little bit about that. You are doing a number of things right now, but you started with your own journey when you were running Ovaterra, co-founding and running Ovaterra.
Yeah, my journey in women's health really started back in kind of 2015, 2016. I was training for an Ironman and also thinking about freezing my eggs at the time. I was living in New York and hadn't found a partner yet, but thought maybe I wanted to have the option to be a parent one day. And a number of my friends were going through that process. And I was really frustrated that no one could really bring the data together. I had all this data from my nutritionist, all this guidance from my nutritionist, from my OBGYN, from my functional medicine doctor, from, my Ironman coach, all the wearables I was wearing while I was training. And I was really, stuck in the middle trying to figure out, how all of this data came together, how, if any, if at all, if it was going to affect my future fertility or ability to freeze my eggs. And so I started really looking at the opportunity to bring, how do we bring all this data together? Had a bunch of conversations with investors and other founders in the space. It turns out to go down that pathway, which, I think a lot of people are now doing, fast forward almost 10 years later, is, that was going to have to be essentially software as a medical device, which is just it's a much more regulatory pathway, a longer path to market, things like that. But in those conversations, I ended up going to South Africa to freeze my eggs at a third of the cost. It was cheaper for me to fly to a foreign country and freeze my eggs there and do my storage there than it was for me to do it in, New York City or another large market in the US. And after I did that, a number of my friends said, well, how did you do it? And where did you go? And, what clinic did you use and things like that? And so I, like a good entrepreneur, just productized it and said, okay, well, here's what I did and here's where I went and here's how I can do it for you. And we ended up having our first trip planned with 34 female founders to go to South Africa, meet a number of investors, a number of other female founders from around the world, and actually go through the egg freezing process. And that was a company called Renew Fertility. It still sits up on a nice box. It hasn't really been active since before COVID because unfortunately that first trip was supposed to be in March of 2020. So you can imagine that didn't necessarily go anywhere, but there still very much is a business and an opportunity for people who maybe can't afford to do it in the United States to travel abroad. But then as a part of these other conversations, I started talking to investors, ended up getting matched with my co-founder from Ovaterra, who is a world-renowned reproductive endocrinologist on the Upper East Side in Manhattan. And he was sitting on a portfolio of IP and just needed help bringing it to market. And I think, Alyssa, you probably see this in a lot of your other colleagues where they're doing amazing research, but just don't have the time and the space and the capacity to actually, commercialize it and bring it out into the world. And so that's essentially what Ovaterra was an ability and a brand and a way for a lot of this amazing research in the fertility space to come to market. So we ended up launching 9 products, a number of patented products, patented supplements, and then a couple of at-home tests and algorithms for premature ovarian aging and things like that. So that was my kind of foray into the business world.
My head is spinning because I'm just like taking a moment out of my everyday OBGYN world and hearing so many points of your story that come up in my day-to-day practice. So, first and foremost, I will mention that so many young women, whether it's just because they want to delay childbearing or just want to sort of have this quote unquote insurance policy, are really pursuing egg freezing at much younger ages. We used to bring this up at earliest age 32. Now it's really in late 20s that a lot of young women are really looking at this. In regard to your experience in South Africa, I'm just curious how different, other than cost-wise, was it to go through this than it is in the US? Because it does seem to be, ridden with hurdles here, not only cost related, but also, is this covered by insurance? Is it, what are the procedures like? Where are they done? All these contracts that need to be signed and, agreed upon for storage. So maybe just go into that a little bit as compared to South Africa.
Yeah, absolutely. So I ended up also giving birth to my first daughter in South Africa. So fast forward, actually on that trip, I ended up meeting my husband. It's going to be a lifetime Christmas movie one day, we joke. And so I'll just talk about my experience generally in the South African healthcare system. I think the interesting thing about South Africa is because it really sits essentially kind of in the middle between the East and the West, you get kind of the best of Western medicine, the best of Eastern medicine, and the best of kind of European medicine. And you get to really cherry pick between a lot of those opportunities in South Africa. And there is a public and a private healthcare system in South Africa, a little, similar to countries like the UK or Canada. If you are in the kind of public sector, you do have healthcare there. It is challenged, and I would say it is they aim to deliver it at a very high quality, but just the volume makes it hard for wait times and things like that, similar to the UK and Canada and other markets. But the private healthcare system in South Africa is world class, right? They did I think some of the first heart transplants or work around heart transplants in South Africa. Their genetic work there around COVID was also world class and absolutely industry leading. And the ability for you as a consumer to actually access the healthcare system, pharmacists in South Africa play a much bigger role in terms of, you don't go to a primary care physician, you just actually go to the pharmacist, and the pharmacist can, diagnose you and prescribe, up to a certain degree, a certain level of practice. And so, I would take my kids to the pharmacy instead of the pediatrician if they were just, sick and needed a quick check. So it's a little bit of
Jodi, one of the things that there's so many points in there, but one of the things you're mentioning is that it's absolutely relevant for the practice of care and for building businesses is really understanding not only the regulatory environment in which you're in, but the culture as well. And you find, obviously, when you go outside the United States, that it's dangerous to think that we represent the rest of the world. I'm curious, and Alyssa, I know you've seen this progress over the course of your career. How is it connected in terms of employer coverage? One of the biggest changes we've seen is, and I always frame it in economic terms, when the Googles and the Facebook, Metas of the world, but Facebook, when they did it, started offering that as a service, it was really, in my mind, a way to keep these high potential growing executives
Mhm.
in the fold rather than having them leave when it came to childcare and losing a whole talent pool. So I'm curious how the employers, if at all, interact in this process. And as Alyssa mentioned, the payment piece.
Yeah, the private healthcare system in South Africa is funded by the employer. So you really, unless you are paying strictly cash, which is possible because it's on the rand, and the rand to the dollar exchange rate hovers between 15 and 20. And so the economics there, especially if you're coming with dollars or a stronger currency, are very, very good. I mean, I think it cost me all in like a cash pay $1,500 to give birth to my daughter. It was good, in South Africa. That's crazy.
I think
And
we'll feel like
so
the phones at United will be ringing off about people. You're going to drive tourism in South
yeah,
Africa with that.
I just had a story yesterday where I'm in the process of trying to get an iron transfusion because I'm low and anemic, and here it's been denied by, well,
Yeah.
I won't name the insurance company, but an insurance company. And I literally told them on the phone yesterday, I said, the cash pay price is something like $2,500 in the United States. I said, it is cheaper for me to get on a plane tomorrow, fly
Yeah.
to South Africa, get the iron infusion and fly back than it would be for me to do a transfusion here. So
Amazing.
it's so frustrating.
Alyssa, one
Yeah.
of the things that you really have built your practice on and your professional experience is this very holistic approach. And that word, I want it to have some meaning. So you're not just looking at reproductive medicine, you're looking at sexual health. You take a broad view. Tell me how that impacts when you're speaking, with patients in your office, East versus West, how you help them manage through the many, many options that they might have to build a family.
Yeah, well, this is kind of why I was just trying to get a general idea of what it was like in another country. I think that, there's a little skepticism in the traditional medical training here in the US about nutritional supplements and vitamins and things of that nature. And I think we're trying to really play very well in the sandbox now in terms of trying to mix, different paradigms, if you will. So, look, I mean, most OBGYNs are trained to learn about prenatal vitamins, and that's kind of the end of that. And right now, our general advice is you can get an amazing over-the-counter prenatal vitamin, which you should start during preconception and take during
Mhm.
pregnancy. But really, as you mentioned, holistic care, everybody has different needs. So there may be different avenues to pursue in terms of vitamins and supplements. But one thing I wanted to bring up and get your thoughts on, Jodi, is the research as it applies to pregnant or preconceptual women and or couples, because this is such a challenging group to research in the
Mhm.
sense that, it's always the above all do no harm. Oftentimes, pregnant people are not permitted to be involved in research for obvious reason. We
Yep.
worry about outcomes. So, any thoughts on that as it applies to your previous position or position currently with
Yeah.
Ovaterra?
Yeah, I mean, I think the research drives a lot of the regulation, and so the relation between research and regulation, I think, is really important to mention.
Mm-hmm.
And I'll give you an example. One of our products at Ovaterra was a DHEA based
Yeah.
product. That research related to pregnancy and specifically preconception is a little bit controversial, right? Like, there's studies on both sides that show that maybe it helps, maybe it doesn't help. And in the United States is one of only two countries in the world where you can actually buy DHEA over the counter. In every other country, it is a
Mm-hmm.
controlled substance.
Right.
But in order for us to sell it in the United States over the counter as a supplement, you really need randomized control trials in order to validate and show the efficacy of that product. The challenge is, to your point, Alyssa, you're not going to get a randomized control trial in a preconception group of people because of the potential for negative
Yeah.
effects right on that patient. And so having to navigate that specific product as a part of our product line with Ovaterra was really hard because we didn't have the RCTs that we needed in order to make the claims that we needed to make in order to then, for the FDA, in order to then be able to, to sell the product at its full, I would say, capacity or ability. So that's a great example of how if you can't get the research, you can't get the regulations, and then you can't get the product on the market to be able to market it at the full. We were able to sell it, but we weren't really able to use the research as a way to sell the product because the research wasn't a randomized control trial.
So
Yeah, and to that point, I mean, there was a lot of There is a lot of controversy about the use of DHEA in
Hmm.
general, with
Yeah.
some really being quite in favor of it and some not so much, as it is sort of a pre-hormone, if you will. But
Yep.
let's move
Yeah.
on. So here's today's hot flash. Fertility is really at top of mind in the conversation these days in women's health. In fact, in the US, 20% of the population doesn't have their first child until after the age of 35. This is a big change.
You created this business called In Women's Health. So, what's so interesting to us about doing this show is really the intersection of the business and the science and how those come together and looking at unmet needs. You saw an unmet need on the business side. Tell us a little bit about how and why you created In Women's Health, the platform, and what you're hoping to accomplish.
Yeah, so as a multi-time founder in this space and all of my founder friends were getting this too, I would say at least every day I was getting 2 or 3 LinkedIn messages from people saying, I'm so passionate about women's health. I want to leave my current role in whatever industry you were in and move into the women's health space. And every request was, can I have 15 minutes of your time? Can I have 30 minutes of your time? Can I please speak with you? And unfortunately, as much as I would love to speak with everybody who reached out, and Rachel, I know you're the same, you just don't have the capacity to do that as a founder. But what was frustrating to me is that I didn't have anywhere to send. I didn't have any. I was like, there was like the end of the road. I was like, sorry, I can't meet with you. There wasn't anything else or any other support I could provide. And so at the same time, because I had been in the industry for so long, a lot of my founder friends were reaching out to me saying, I need to hire my first engineer. I need to hire my first, chief of staff or whatever. Who do you know? Who's good? Who's in the ecosystem? And so that happened to me at a conference back in February, not last, 2 years ago in February. And I just went back to my hotel room, and that was right when all the layoffs were happening at Twitter and in the Valley, kind of right as we're coming out of the COVID pandemic. And I just put it together in a newsletter. I sent it out to everyone who had reached out to me that week on LinkedIn. And then I just decided to randomly post it on LinkedIn. And I woke up the next morning and we had 600 people subscribed to this Substack. And it just sort of demonstrated to me that, hey, there's a really interesting need here. So started writing this newsletter that I still do today. It's a weekly newsletter with jobs in women's health. And then people started, thanking me, sending me emails and saying, thank you so much for writing this. This is amazing. Is there any way I can meet others who are looking for jobs in the women's health space? So we started a Slack community later that year where people could gather, online and at least have conversations. And then in that community, I started realizing there was just a lot of work and education that we needed to do about the business of women's health. So even if you are coming from a healthcare environment into women's health, there are a lot of nuances about the space that are, Alyssa, reimbursement, right? Marketing and the women's health space, building product on data and privacy and how important that is. And just people weren't understanding these nuances. And I'd also seen that in how I had hired people at Ovaterra and in some of my other organizations in consumer health. And so we just put together, Rachel and I ended up putting together the Women's Health Mini MBA, which is a 6-week program that allows anyone in the ecosystem, so investors, CEOs, founders, talent, to really come in and learn kind of a high level American healthcare system, but then we really dive in over that 6 weeks period into the nuances of women's health. So it started as a career sort of platform and newsletter, just as a way for all of us founders to be able to give back to those who reached out to us. And it's really now evolved into the ecosystem's only education platform about the business of women's health. I was talking to someone yesterday, and we're going to now do over the course of Q1 and Q2 some courses on value-based care and women's health, Medicaid and women's health.
Oh my God.
How to talk to insurance companies.
Yeah. I'm going to fall off my chair just even thinking about these things, just because they're so stress inducing. But where does the clinician fall in your ecosystem? Because with all the AI stuff and all the EHR stuff, meaning the medical records, which is a truly onerous task for anybody who's on the front line of medical care, where does the clinician fall in this platform and in your ecosystem? Because it just seems like we still need to have our voice in the way these businesses are being created.
100%. And Alyssa, I think Rachel would say the same thing. I will never build a business in women's health without a clinician right on my right-hand side. Right. I
Yay.
think and if I ever look at businesses that are raising money in the space who don't have a clinician involved, it is the first thing I say to them is go get a clinician partner and come back in 3 to 6 months and have a conversation with me. So I really do not think anyone in women's health should be building businesses without a clinician partner, sort of first of all. And say second of all, in terms of the talent, I can't tell you how many people and clinicians reach out to me on a weekly basis who are looking to leave clinical practice, but still use their clinical training in a business setting. And so we actually have a lot of clinicians on our platform who have taken the class, who have taken some of our other classes, who have just trying to connect with others to really make that transition, out of day-to-day patient care, but still bringing all of that knowledge of the patient care experience to the business side of what they want to do now. And there are a couple of other communities I would be remiss to not mention those where it is specifically for clinicians who are looking to make that transition. So we partner a lot with those communities to do content and events and experiences, but there are places now for clinicians to gather who might be looking at, what's the next chapter in their career.
That's great to hear. We don't want to be left out, number one.
Yeah.
Number two, it's super exciting.
Definitely
and number
not.
three, I think it really helps our patients, which is first and foremost what we're really trying to do. Do you have solutions that you discuss on this platform or have expertise in regarding all of the newer AI that's coming in for both treatment paradigms, but also to help with the overwhelming task of charting? How is this going to get fixed in your mind?
Yeah, I think totally. Some of the content we're doing later this year is more of I would call it a 101 level, right? Like just AI 101 in women's health, what's happening out there. And in that content, it is who do you need to know? What companies are doing some interesting things across the board? So not only in actual delivery of care, but also in practice management, making your life easier, how to do things more efficiently. But Alyssa, I think we might have just come up with a great course together on how to use AI in your practice, right? Right.
And one of the other things that we do, Alyssa, in the course, which is really Jodi's brainchild, is, I would say one of my superpowers is knowing what I don't know. And so one of the things that we do is we bring in physicians, we bring in experts, we bring in physicians running companies, we bring in regulatory experts. If we're talking about product, we bring in a product designer. And you and I have talked about this so many times. As soon as you separate the clinical from the business, you've lost me, you've lost you, and obviously you've lost Jodi. And having just spent a couple days at JP Morgan, where there are tons of clinicians, both who are in business and advising companies, they'll be the first to say, and you'll be the first to say, there are things that lend themselves to AI or to telemedicine. But there's no scenario that you and I have seen or talk about where the clinician is not critical. I mean, we all know that in our own jobs. I don't get worried about being replaced by AI. That doesn't mean there aren't tasks that could be much better done by AI, but there is the critical thinking and the analysis and the art part of what you do that, hopefully will never be done by a machine and not a human.
Yeah. Rachel, I don't know if you shared with Alyssa, but the panel discussion we heard, it was talking, Alyssa, about the underlying training models in AI and specifically the challenge of those training models related to women's health. And they gave the person on the panel gave an example that one of the models that they had seen and they had run, the data underneath it was it didn't reflect women enough to the point where the model said that, we predict that only 30% of women are going to go through menopause. Right?
Oh, that's so funny.
So clearly that model hadn't been trained on enough women's health data to understand, obviously what happens with women's bodies.
Okay, so newsflash AI, it's going to be 100%. It's ubiquitous, although I think there are some people working on altering that statistic. Yep. I will say, there's also just such a difference in demographics of practice. I practice in New York City. There is a very different avenue to pursue in terms of care compared to like a really rural area. Even on the West Coast, we see a lot of different nuances. So I think that will come into play.
I agree with you. Yep.
So just to keep juggling those balls that you have, you also created the Women's Health Pack
Hmm.
last year, Political Action
Yep.
Committee. Talk a little bit about the motivation for it and what your
Mhm.
approach has been to really make progress uh, in women's health. And as both of you know, you have to take a very measured approach and be very clear about your communication when you're trying to have an impact on established systems.
Totally. So I think two things. I had the opportunity to work on a independent candidates presidential super PAC in my, after I left Ovaterra. And it was really eye-opening to me to understand that truly this is how stuff gets done in the American government. As much as we may not want to admit it, money moves, moves policy. And so I was like, there has to be something like this for women's health. And when I looked around, we couldn't find anything. We found a couple of PACs that were focused on I would say more like the structure. So there were a couple of hospital system PACs, a couple of private equity, OBGYN, group PACs, but nothing that was looking at the systemic nature of women's health, kind of across the board. And there's PACs that are focused on pay, parental leave and sort of things like that, but nothing systemically. And so I got together with two co-founders, Liz Powell and Candace McDonald, and the three of us, given our experience, one is a lobbyist on Capitol Hill, and the other is a lot of significant experience building movements and building PACs. And we just said, look, we need to do something. It was in the federal election year, 2024. We knew it was going to be contentious. Obviously, reproductive rights were a big part of that election conversation. And so we just said, let's roll this out. Let's launch a PAC and kind of see what happens with a much bigger vision that we kind of had in the back of our heads of where this could potentially go. But we wanted to get this proof of concept first. And what's really important to understand is in America, we haven't really talked about women's health as a unifying issue, as a way to bring us together specifically as women and allies of women. We have a lot of division specifically around the reproductive choice issue, abortion issue, but that keeps us divided as women. But frankly, that is one issue. I mean, every single woman will go through menopause. Every single woman will have her first menstrual period, right? A lot of women will have a baby. A lot of women will go through a fertility experience or Alzheimer's or cardiovascular issues or cancer. So there's just so many other issues outside of this one over here that unify us, that we have this shared experience. And I have the amazing ability or kind of experience of I've lived in very progressive New York City. But I have family who lives in Arkansas and in South Dakota, and I'm a daughter of a farmer and a teacher, and so I get to eat, sleep, and breathe, the both sides of America, both rural and
Mhm.
urban, and really seeing, I might disagree with my cousins on, being pro-life or pro-choice, but at the end of the day, she had fertility issues. I went through egg freezing. We're both at higher risk for certain things because of our family history. And so I really saw it as a way to bring us together. And that's really what we saw with the Women's Health PAC. It is a bipartisan PAC. We support both Republican and Democratic candidates. And in 2024, we ended up raising about $250,000 and supported 16 candidates in the federal election cycle. 12 of them got elected, and one of them has now been nominated as the incoming Secretary of Labor. So we ended up having this amazing unifying experience across the board. We had 7 events around the country, about 150 to 200 people attending each one. And it really just was an awesome opportunity for people to do something. I think that was the other insight we had, is that women and men who want to be involved in women's health want to do something. And all we were telling women was to make sure you vote. And that started to not feel like enough. And so providing women and men an outlet to actually get involved, to write a check, to come to events, to meet other people who are like-minded, was really interesting.
And
So
one of the
it's been
interesting
an amazing
things
journey.
from that, you and your co-founders communicated was we are talking about the parts of women's health that we can agree on. We're talking
Exactly.
about the enormous burden. We're talking about the enormous cost. We're talking about the impact on family. We're talking about the lack of research. So I just think it's a good example of, rather than focusing on the most divisive, the most controversial area where emotions run high, you're really focusing on what are the policies? You know,
Yeah, and I think, Rachel,
what's being reimbursed, what's being researched.
Yeah, and I think that's really where, having run a number of businesses in this space, and Alyssa, you eat, sleep, and breathe this every single day. If we don't make women's health more profitable, we are all in trouble. We are having labor and delivery units closing in rural areas because the reimbursement rate for delivering a baby is $4,000 less than what it actually costs them to deliver that care. And so if we don't fix the reimbursement structure for women's health, we are all going to suffer, regardless of what your views are on, the abortion issue in particular. And so that's that's the next phase now that we've supported these candidates, is we're hosting the first ever summit on reimbursement for women's health later this year, bringing together about 30 to 40 practitioners who do this every single day and have built businesses in the space, who understand some of the challenges. And we're going to put together the first policy document for reimbursement, systemic reimbursement in women's health. And we really feel like there are a few things we can do at a very federal and systemic level that might help all of us. So we're looking at, what are some CPT codes that could be potentially exempt from the budget neutrality rule, right? What are some, how do we work with CMS to help them understand that they don't have to take the recommendation by law of the RUC committee? And here's the challenge of, here's how the RUC committee works, and here's where women are underrepresented in the RUC committee structure. And that's the committee that sets the RVU values from a reimbursement perspective. So, we're looking at kind of these very systemic, is there something we can do around the well women visit? I don't know. A couple of years ago, colonoscopy screenings, or screenings for colon cancer, were covered by preventative care, the ACA, but people were getting surprise bills for the follow-on care related to that screening. That has now been changed, and the structure exists now to where anything that is done as a part of a screening for colon cancer is actually fully covered. And from a women's health perspective, we're trying to follow that same model, right? So if someone comes in for their well woman preventative care visit, and something is done as a part of that, how can we have that long tail of care covered so that people aren't getting surprise bills off of their well woman exam, for example?
Well,
so those are just some
one of the
examples
other
of things we're
carve-outs
looking
we could
at.
have is how you manage to fit, 17 things in a 24-hour day that involves sleeping and eating. So
Yeah.
Well,
feel lucky to
first, I
have you
think
as
we
part of the
we
ecosystem.
need a little time to actually see
Yeah.
our patients,
Yes,
rather than
exactly.
being given these very artificial time limits. There is so much that we could speak about here, because this just goes so deep for all three of us. But I really
Yeah.
applaud all of this work that you're doing. Women are not little men in the medical world, and I think
Nope.
that's a really good sentence to close on.
Yeah, no, absolutely. And I think, what we've realized now is that I think it's, if we lean on government, and if we lean on venture capital, and if we lean on sort of these other people to make the changes, we're going to be waiting for a long period of time. And so the next phase of the PAC is for us to create essentially a membership-based organization where women can become a member of this, this kind of newer organization. And that actually will fund a lot of the research, a lot of the innovation, a lot of the policy work, and a lot of the lobbying that we need to do as an ecosystem.
It absolutely takes a village. We want to thank you so much for all the work that you're doing and for taking time to be with us today. And we'll be cheering you on.
Thanks, Rachel. Thanks, Alyssa. Thank you so much for having me.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.